So now we'll see about blood vessels. So under blood vessels, vasculitis is the most important chapter for MCQs. Okay. So under what is vasculitis? As the name suggests, it is going to be inflammation of the blood vessels. So it can be either large blood vessels which are being involved, or medium sized blood vessels which are involved, or the small sized blood vessels. So based on this, we have certain syndromes which certain diseases which present with certain features. Okay. So under large vessel vasculitis, we have giant cell arteritis and Takayasu arteritis. Then under medium vessel vasculitis, we have polyarteritis nodosa, Kawasaki disease and Burgess disease. And under small vessel vasculitis, we have two types, which is immune complex mediated and post-immune or non-immune complex mediated. So under immune complex mediated, we have SLE, Henoch-Schönlein purpura and Goodpasture syndrome. And small vessel post-immune vasculitis, we have Wegener's disease or granulomatosis with polyangiitis, microscopic polyangiitis, and Church-Strauch syndrome or eosinophilic granulomatosis with polyangiitis. So we'll be seeing one by one. So in large vessel vasculitis, I mentioned two diseases, giant cell arteritis and Takayasu arteritis. So both of these features, both of these diseases are going to have a overlapping kind of presentation only. That is the basic microscopic features are going to be the same. It is just the kind of vessels which are being involved and the symptoms which they produce are going to be different. So in giant cell arteritis, it is going to be the most common vasculitis which we see in adults. And here it is going to be affecting more than 50 years patients and usually females commonly. And the most common vessel involved in a giant cell arteritis will be a superficial temporal artery. So here the vessels will be quite prominent and thick and nodular. So in this image, if you see, this artery is very thick and prominent, right? So this is a classical feature which we see in a giant cell arteritis. So when this arteritis is present, there is going to be localized headache at that area. So that will be the classical history they'll be giving. Other than that, the other arteries which can be involved will be ophthalmic arteries and vertebral arteries. So when ophthalmic artery is being involved, it can result in sudden blindness also. So that is why it is very important to diagnose this disease. And usually the patient can also give symptoms of jaw claudication. It will be stuck. So jaw claudication can be seen, and it can be associated with polymyalgia rheumatica. So it is a connective tissue disorder seen commonly in females. And the microscopic findings which we see in both of this large vessel vasculitis will be a granulomatous inflammation. So it is an example of granulomatous inflammation. So in the vessel wall, if you see, there will be formation of these granulomas. So if you can appreciate, this is going to be a these cells are all the epithelioid macrophages, surrounding which we have these lymphocytic cells, and this is a giant cell. So this classical granulomatous inflammation can be seen on the vessel wall. The second image is also the same. This is the granulomatous inflammation seen in the vessel wall. And here the very important thing is this granulomatous inflammation can be segmental. That is, it cannot be seen throughout the vessel. So suppose there is, it can be seen at this part but not seen at this part. So it is very important to take a adequate biopsy to prove that it is a giant cell arteritis, and the adequate biopsy length is 1 centimeter. Okay. And you can also see fragmentation of the internal elastic lamina. So it will be stained by VVG stain. So Wonjak stain will stain the elastin. So here this is the internal elastic lamina, but here it is becoming discontinuous. So this fragmentation is what we call as is what we see in this giant cell arteritis. So next we'll be seeing about the other large vessel vasculitis, which is Takayasu arteritis. Takayasu arteritis, it is going to be seen in age group of less than 50 years. And here the most common vessel being involved will be the subclavian artery. Subclavian artery is a branch of the aorta. So that is the most common vessel, and the subclavian artery is going to supply the upper limb. So because of this vasculitis, the patient will not have pulse on their upper limb. So it is also called as the pulseless disease on the upper limb. Then if you see the gross findings, you can see that there is going to be intimal thickening. So this layer is going to be the intima, which is quite thickened, and it is narrowing the vascular lumen. Right? And other than that, there will be medial attenuation. So this layer is going to be the media, this white layer, and it is all attenuated. Then the next layer will be the adventitia. It is all thickened and fibrosed. So this kind of vascular thickening with attenuation of the vascular lumen will be seen in this Takayasu arteritis, especially in the subclavian artery. And here it will be the pulseless disease with which they present, and the microscopic images will be the same as in a giant cell arteritis.